Mehul Shah, your work is truly inspiring, not just from the quality of the work that you do as an individual, you do as a team with Dr. Shreya, and you do as a team with all members of Drashti Netralia, but you've now taken it a bit further and translating it into education and training, setting standards, and it's truly inspiring. And we hope to interact with you and learn from you so that we can create a global platform to raise standards of care and training in ophthalmic trauma. Thank you very much for accepting our invitation to talk. It's my pleasure now to
Thank you very
introduce.
much.
Yeah, thank you. It's my pleasure now to introduce Dr. Eli Pradhan from Tilganga Hospital in Kathmandu, Nepal. If you want to know the value of the talk she's going to give you, all you have to do is Google imaging and ocular and adnexal trauma, and it is the leading chapter in the iWiki of the American Academy of Ophthalmology, written by her a couple of years ago. And she's going to share with us her experience and knowledge into interpreting various forms of ophthalmic trauma imaging. Dr. Eli,
Thank you,
Dr.
Dr.
Can you
Ganga.
stop sharing, please?
Yeah.
Dr. Mehul, can you stop your screen share? Then we can upload slides of Dr. Eli.
Thank you. Thank you, Dr. Ganga and Dr. Rupesh for inviting me, and also Namrata ma'am. Yeah, okay. So Dr. Rupesh has shared my screen. So this is this is about diagnostic investigation in ocular trauma. I'm from Tilganga Institute of Ophthalmology. No financial disclosure. As you all know that imaging is very important to assess extent of injuries because of surrounding a periorbital soft tissue swelling and other associated injuries, and physical examination is difficult, especially in case of acute trauma, as patient cooperation may be limited by unresponsiveness, altered medication, or sedation. Next slide. So we have various techniques like plain X-ray, ultrasound, ultrasonography A and B scan and UVM, computerized tomography scan, magnetic resonance imaging, and optical coherence tomography. Plain radiograph, it has 64 to 78% of sensitivity for orbital fractures, but this value is much lower for soft tissue injuries assessment. It is the first step for metallic intraocular foreign body due to its accessibility and low cost. For direct visualization, two exposures are necessary at right angles. One is AP and lateral view are taken. And this picture is showing radio-opaque foreign body in left orbit. Another one is limbal ring. Although it is obsolete at present, it is made up of either silver or steel with suitable diameter sutured to limbal limbus. X-ray is taken with metallic limbal ring or contact lens with radio-opaque marker over cornea. As you can see, these are the foreign bodies. There are advantages and disadvantages. Advantages are it documents the presence and number of metallic foreign bodies in higher orbit. It defines orbital wall and skull fractures very well. It's cost effective. It has the documentary and medical legal role, which is very, again, important. However, it is less specific in foreign body localization, cannot identify radiolucent foreign body. It fails to show existence and extent of penetrating or blunt trauma. Another one is ultrasonography. It is non-invasive, inexpensive, non-ionizing, and easily performed imaging technique. Is useful for evaluating eyeball measures, layers, and contents. It's 98% sensitive in detecting intraocular foreign body in appropriate setting. And this one is, the lower one is a scan showing highly steep rising echo spikes with high reflectivity. And this one is highly acoustic, contrasting with acoustically clear vitreous. So this is the foreign body here. And now this one is moderate to low echogenic reflectivity and highly mobile, which disappears in low gain. This is the vitreous hemorrhage, and this is the next one is ultrasound B scan showing dislocated lens. Next, please. Now this one is this like a V-shaped, it is echogenic lines. It is forming. This is the sign of acute retinal detachment. Echogenically. It's consistent with blood. And this one is this is the choroidal, hemorrhagic choroidal choroidal detachment. Next slide. So advantages and disadvantages of ultrasound again, it is useful in opaque media. It detects and localizes radiolucent foreign bodies. It also shows that lens position and zonal integrity can be noticed. And it is useful intraoperatively in deciding the scope of primary repair. However, it is difficult to localize deep-seated foreign bodies, difficult to perform in open globe injuries. Extraocular muscles are not clearly defined, and limited visualization of optic nerve and retroorbital structures, and poor detection of scleral tissues. Next one is ultrasound by microscopy or UBM. It is imaging technique that uses high frequency sound waves to produce high resolution cross-sectional images of anterior up to the depth of 5 millimeter. And in case of trauma, it can visualize angle recession, cyclodialysis, zonal dialysis, hyphema, scleral laceration, and intraocular foreign body, as you can see here. It also shows, it can show appearance of foreign body surrounding tissue, also the exact location, size, and nature of intraocular foreign body, much better than conventional low frequency ultrasound. It is also useful for detecting and localizing a small, superficial non-metallic foreign body, which is usually missed either in CT or conventional ultrasound. This is the highly reflective intraocular foreign body in the inferior angle with echoes. Next one. Now, next one is the computerized tomography scan. It is considered the best imaging technique in ocular orbital trauma because it assesses intracranial, facial, and ocular structures. It is available imaging option in almost most of the emergency services in main hospital, and on enhanced orbital CT scan is the first choice to evaluate orbital trauma. And if vascular injuries are suspected, an enhanced CT is recommended, indicated, also useful when blunt or penetrating trauma is suspected. So these are the different structures which we see. All structures which is shown here. In case of open globe injury, the changes in, this is the right eye, the contour of the globe is lost. This is the flat tire, continuity, and intraocular air and intraocular foreign bodies can be seen in case of open globe injury. And it is definitely the first choice when metallic fragments are suspected, and like in this one, it is seen very close to the optic disc, and its sensitivity is less, however, for glass and wooden materials, which can appear as hypoattenuating structures that can be confused for air bubbles. Without clinical history or ocular examination, CT scan has 75% sensitivity and 93% specificity for open globe injuries, diagnosis if there is complete ocular examination previously. And if there is hypotonia with no clinical evidence of anterior perforation, it helps to evaluate posterior segment evaluation properly. Like in this case, this has the left dislocated lens is seen in the axial scan of axial CT scan. Advantages, it detects soft tissue injuries and orbital wall fractures precisely. It has easy recognition of intraorbital and ocular air. Clearly defines most radiolucent foreign bodies, also has exact localization of foreign body. We can also do simultaneous examination of brain and paranasal sinus. Contrast in her CT is valuable in suspected vascular trauma. It also detects optic canal fractures. However, thick CT slices may miss small metallic foreign bodies, and multiple tightly clustered metallic foreign bodies may be obscured by artifacts and fails to delineate wooden foreign bodies where MRI is important. Now, the MRI is indicated to visualize optic nerve and soft tissue in case of visual loss or when there is ocular mobility impairment. However, it is contraindicated when intraorbital metallic foreign body is suspected. And best option for detecting non-metallic materials inside the globe when CT fails to find is the MRI. It must be done to assess optic nerve injury if suspected, which is assessed by T2 high signal intensity signal. Like, yeah, next slide. So this picture, the first one, A and B, it shows only the low attenuated defect, but how it fails to show any definite foreign body. And the lower one, B, C, and D, it shows there's infection surrounding low signal foreign body here, this one and this one. And during surgery, this a small piece of wooden foreign body was removed. So advantages: better soft tissue delineation, quite sensitive for visualizing small amount of blood, excellent visualization of posterior fossa, better resolution of low density objects like vegetative matter and wooden foreign bodies. And also optic nerve laceration is also has better resolution or avulsion at intracanalicular portion. It detects optic nerve swelling as well. However, it is less helpful than CT in evaluating bony abnormalities. Longer scanning times needed and cannot be used if there is suspicion of metallic foreign body. Optical coherence tomography, it is another powerful non-invasive tool for evaluating macula, especially in case of macular trauma, because it provides detailed images of anatomical structure of the eye for diagnostic purposes, or also monitors various macular and chororetinal pathological changes, particularly in acute traumatic maculopathy. So this is the spectral domain OCT imaging after trauma. This is the outer retinal layer swelling with preservation of the inner layer, disruption of outer retinal nuclear layer and inner and outer segment with cystic disruption at the outer plexiform layer. The next slide. This is again spectral domain showing foveal thinning in all the layers after systemic steroid therapy for 2 weeks. Although retinal splitting in the foveal region was resolved, it shows the outer layer shows disruption of the outer foveal layer under the fovea. Next. So these are the pictures. The first one on the left side is this is the cystic changes on the fovea following blunt trauma, and on the right side this is the hemorrhage at the foveal region with the back shadowing exactly at the fovea because of the hemorrhage exactly at the macular region. This is because of the blunt trauma. So therefore, the ocular trauma is one of the most common reasons for ophthalmology consultation in emergency department. USC is non-invasive, simple, and effective diagnostic method which enables visualization and evaluation of intraocular injuries in opaque media. CT orbit can detect many abnormalities and also complements bedside ophthalmic examination, which are usually limited in the setting of trauma. And MRI is an important modality, especially in case of soft tissue assessment or organic foreign bodies, and OCT, the main importance is in blunt trauma. And thank you very much again for giving me this opportunity. Thank you.